Hello, everyone, and welcome to today's lecture on governmental involvement in healthcare and health economics. This is Dr. Shankar at the American University of Health Sciences. I'm excited to explore this critical topic with you today, as understanding how government shapes our healthcare system is essential for any healthcare professional. Today, we'll be covering two main areas. First, we'll examine the governmental structure that oversees healthcare in the United States, the key committees and federal agencies that make the decisions affecting millions of Americans every day. Then we'll delve into the economic principles that underpin healthcare policy and examine one of the most fundamental debates in healthcare. Is healthcare a right or a privilege? By the end of this lecture, you should be able to describe the major committees and federal agencies involved in U.S. healthcare, explain how supply and demand principles apply to our healthcare system, identify the conflicting views on healthcare as a right versus a privilege. Let's begin with understanding how our government is structured to handle healthcare issues. Healthcare is a broad and complex field that encompasses numerous policy issues. Because of this complexity, multiple congressional committees share responsibility for healthcare oversight. These committees serve three primary functions: authorizing federal programs, funding those authorized programs, and creating new laws for the executive branch to implement. Healthcare policy is influenced by several key issues: insurance coverage, healthcare professional education and training, program development to support healthcare improvements, and the discovery and implementation of new medical knowledge. Now, let's examine the specific committees that shape healthcare policy. The House of Representatives Judiciary Committee and the Senate Committee on the Judiciary handle the legal aspects of healthcare. These committees oversee issues such as tort claims arising from medical malpractice and product liability cases, interstate commerce regulations that affect healthcare, protection of intellectual property resulting from biomedical research. Both committees also provide oversight for the U.S. Department of Justice, which can be involved in healthcare-related legal matters. The House Committee on Ways and Means and Senate Committees on Finance play crucial roles in healthcare financing. These committees oversee some of our largest healthcare programs. The Medicare program provides insurance coverage to adults 65 and older as well as individuals with disabilities. This program is funded through the Medicare Trust Fund, which is part of the Social Security Act and supported by payroll taxes. These committees oversee all Medicare-related legislation, including how providers are paid for services. Medicare also receives funding through payments for insurance coverage for physician services and other healthcare professionals. The committees oversee Medicare Part B payments to authorized providers and also have jurisdiction over the Medicaid program. The House Committee on Energy and Commerce has broad jurisdiction over healthcare issues. This committee handles legislation related to healthcare delivery, public health programs, and healthcare infrastructure. Their work often intersects with both Medicare funding and broader healthcare policy initiatives. Now let's turn to the federal agencies that implement healthcare policy. There are four major agencies you need to understand: Department of Health and Human Services, HHS, Centers for Disease Control and Prevention, CDC, Centers for Medicare and Medicaid Services, CMS, Food and Drug Administration, FDA. Let's examine each of these in detail. The Department of Health and Human Services is the #1 funding federal agency of all U.S. federal departments. It's also the federal agency with the greatest involvement in healthcare overall. HHS's mission is to enhance and protect the health and well-being of all Americans. This broad mandate encompasses everything from disease prevention to healthcare financing to medical research. Think of HHS as the umbrella organization under which most federal healthcare activities operate. The CDC is the largest division of HHS and focuses specifically on population health. Their mission is to provide health information that protects our nation against expensive and dangerous health threats and respond when these arise. We saw the CDC's emergency response role clearly during COVID-19, but their work extends far beyond crisis response. The CDC actively manages preventive health programs, including immunization schedules across the entire life cycle, evidence-based health promotion and disease prevention programs, the National Diabetes Prevention Program. The CDC also collects, analyzes, and shares local, state, and national health data with the public through the National Center for Health Statistics, using extensive survey activities to monitor the nation's health. CMS administers three major programs: Medicare, Medicaid, and the Children's Health Insurance Program, CHIP. Let me break down Medicare's structure for you. Part A, hospital care coverage. Part B, service delivery by physicians and other authorized providers. Part C, opportunity for beneficiaries to receive care through private managed care plans. Part D, prescription drug coverage offered through private managed care plans or private prescription drug plans. CMS essentially serves as the largest health insurer in the United States, covering over 100 million Americans through these various programs. The FDA is responsible for ensuring the safety and effectiveness of drugs and medical devices, as well as the purity of food products. This agency plays a critical role in protecting public health by regulating what medications and medical devices can be sold in the United States, ensuring they meet rigorous safety and efficacy standards. Now that we understand the governmental structure overseeing healthcare, let's explore the economic principles that drive healthcare policy decisions. Understanding these economic concepts is crucial for healthcare professionals who need to work effectively within our complex healthcare system. Let's start with fundamental economic principles. In any economy, consumers' wants are limitless, but our society has never had enough resources to meet everyone's demands. This scarcity makes it impossible to satisfy everyone completely. Economics is the study of how individuals and societies allocate their limited resources in attempts to satisfy their unlimited wants. The interaction of supply and demand determines the price system in any market. Supply typically increases as price increases. Providers are willing to offer more services when they can charge higher prices. Demand typically decreases as price increases. Consumers purchase less when prices are higher. Market equilibrium occurs at the point where supply and demand curves intersect, determining both the market price and quantity of goods or services exchanged. Utility refers to the satisfaction obtained from purchasing a particular good or service. While utility is difficult to measure objectively, it's a crucial concept in healthcare economics. People allocate their time, energy, and money to maximize their utility. If the utility of a good or service is greater than its cost, people will buy more of it. Think about buy one, get one free offers. Conversely, if the cost exceeds the perceived utility, people will not purchase it. In healthcare, this becomes complex because the consumer, patient, often isn't the one paying, insurance company, and the decision maker, physician, may not be either the consumer or the payer. Healthcare markets have unique characteristics that distinguish them from typical economic markets. Maldistribution. Some communities have shortages of healthcare providers or facilities, while others may have an oversupply. This geographic maldistribution affects both access and pricing. Consolidation. We're seeing fewer sole practitioners and small group practices while large medical groups continue to grow. This consolidation affects market dynamics significantly. Employer groups form health coalitions to negotiate better rates for healthcare services, and we've seen major consolidation in areas like retail pharmacies. Consider how Target sold its pharmacy operations to CVS, creating fewer competitors in the market. This brings us to one of the most fundamental debates in healthcare policy. Is healthcare a right or a privilege? Those who view healthcare as a right argue healthcare is a prerequisite for individuals to become useful and productive members of society, similar to public education. Some level of healthcare should be provided to everyone. The price system should not be the sole determining factor in deciding who receives healthcare products and services. Those who view healthcare as a privilege argue healthcare is a personal responsibility and a personal choice. Market forces and individual responsibility should determine access. Government involvement should be limited. This philosophical divide underlies most healthcare policy debates in the United States and influences how we structure our healthcare financing and delivery systems. As we wrap up today's lecture, let's consider several important points. Government involvement in healthcare continues to evolve, making public engagement in setting policy parameters increasingly valuable. Like healthcare itself, our government systems are also evolving to meet changing needs. Healthcare practitioners must understand and use economic principles to work effectively with healthcare institutions and insurance programs. The healthcare industry has unique characteristics, and payers continue investigating how to better control costs while improving quality, enabling patients to receive more benefits from our limited resources. Let me leave you with a thought-provoking case study to consider. There's ongoing controversy about how to control rapidly rising healthcare costs while expanding services to millions of uninsured Americans. Some believe encouraging more competition will solve these problems. Others argue healthcare is so unique that competition won't necessarily create efficiencies that reduce costs and improve access. Some also question the morality of using price systems to allocate healthcare resources. I want you to think about these questions. 1. To what extent is healthcare a competitive industry? Does competition always result in price decreases? 2. What can be done to instill competition in healthcare? Are there cases where competition won't decrease prices? 3. What types of healthcare services might be considered for elimination from coverage because their marginal costs exceed their marginal benefits? These questions don't have easy answers, but wrestling with them will deepen your understanding of healthcare economics and policy. Understanding governmental involvement in healthcare and basic economic principles provides the foundation for engaging in informed healthcare policy discussions. As future healthcare professionals, you'll be working within these systems and potentially influencing their evolution. Thank you for your attention today. Please review the assigned readings and come prepared to discuss the case study questions in our next session. If you have questions about today's material, please don't hesitate to reach out during office hours or via email. For additional resources, I recommend Health Economics by Charles E. Phelps, a comprehensive textbook covering fundamental economic principles applied to healthcare. The Economics of Healthcare by William S. Custer focuses on the economic analysis of healthcare markets and policy. Healthcare Policy and Politics, an A to Z guide by Kant Patel and Mark Reshevsky, Comprehensive Guide to Healthcare Policy and Governmental Involvement, Economics of Health and Healthcare by Sherman Foland, Alan Goodman, and Myron Stano, popular textbook covering health economics principles. The Healing of America, a Global Quest for Better, Cheaper, and Fairer Healthcare by T.R. Reid, Comparative Analysis of Healthcare Systems Worldwide.